Hi, I'm Dr. Tsao from the Center for the Treatment and Study of Anxiety at the University of Pennsylvania. Perhaps because of how it's represented in popular media, OCD seems like something it should be very easy to spot. Somebody using a lot of hand sanitizer or excessively scrubbing their countertops or checking or rechecking their door locks over and over again seems like something hard to miss. However, the truth is that oftentimes OCD is very difficult to recognize, even for the people that suffer with them. Some research has shown that it takes over 10 years from the time that somebody first has OCD symptoms until they're actually connected with appropriate treatment. In part, that's because even in this day and age of Googling everything, it's very difficult for people to find the label that accurately describes their symptoms. I've had patients tell me that before being diagnosed with OCD, people were worried that they were some kind of criminal or a danger to everybody around them, especially their loved ones, or that they might be insane. While I wish it wasn't the case, these kinds of reactions are fairly common for people with OCD. This often leads them to being very scared, confused, and embarrassed about their symptoms, and then trying to hide them in any way, shape, or form from those people around them. Another common thing for people with OCD is to engage in what are called mental rituals. And these are compulsions that people will do in their minds to try to make themselves feel better that nobody can see, and can include things like saying reassuring statements to themselves, saying prayers in a set manner or a set number of times in their own mind, thinking of positive outcomes, or reviewing information to try to be sure that nothing bad happened. The last thing that people will do in order to try to prevent people from seeing their OCD is engaging in what's called avoidance. People with OCD will try to stay away from situations or activities that either trigger the obsessions or trigger the urge to want to do compulsions. When this is effective, they may not be able to see whether somebody has OCD. So, for example, you may not see somebody endlessly checking their stove if, when you go and see them, they always suggest that you order out or go out. Or if they prepare something, then they've always prepared cold foods. So if you or somebody else around you is suffering, be aware that there's obviously efforts to hide it, and that's not different from what a lot of people are experiencing. But also be aware that there might be others around you that would be surprising to you that they're suffering from OCD because it is so hard to see. There is help out there if you know where to look. I encourage you to reach out if you're in the area to the Center for the Treatment and Study of Anxiety at UPenn. Thank you.